Why do the patients have to come to the controls? Now, I mean, I'm laughing now a little bit when I think about the two stages, about the osseointegrators. They also ask their patients to come for control, but they can do nothing. If the bone disappears, if the periodontitis sets in, if the infection starts, they can do exactly nothing. They can only watch the road downhill. Now, in the field of osteofixation, in our field with the corticobasal implant, we need the controls, and the most important control is a 3-month control where we control the occlusion, and then the other controls are after 1 year, 2 years, 3 years, and so on, so every 12 months. So why do we have to control the occlusion so quickly? Let's say 3 months is not a lot of time, so quickly after the end of the initial treatment. The reason is that the jaws deform, or they change a little bit their shape. Also, the jaws can change their position, I mean, anteriorly, posteriorly, and so on. And this has to be corrected. I mean, we correct actually the occlusion to make sure that the contact points are in the right place and that they come at the same moment on the left and on the right side, and that this pattern of mastication is bilateral, and that there's no anterior pattern of chewing. All these things are being controlled in all controls, but most important, of course, in the 3-month control. The later controls are, of course, also for occlusion and mastication, but the later controls also will always check if there's enough space between the bridge and the gums, or the bridge and the bone, if you want. Because the bridge has some elasticity in relationship to the jaw bone, so this elasticity must be there all the time. So if bridges are blocked because bone has been growing vertically up to the bridge and the elasticity is missing or is only happening on one side, then there's always a danger of bone loss and of mobility, that implants become mobile. So from this point of view, all the controls are important. On the other hand, if we see after 2-3 years that the gaps are constant, that the occlusion is okay, mastication is okay, we don't have to grind anywhere on the bridge, then we tell the patient that they can come after 2 or 3 years for the next control. So most patients that we have treated are on this 2 or 3 years program already. So we see them only every 2 or 3 years. It's always big hello, but patients are happy and we don't have to do too much. So there's a big difference between the osseointegration method and the osteofixation method. The osseointegration method, they try to control, but if something goes wrong, they can do nothing. In our case, the controls are really important, and they need to be carried out by authorized simple clinic, by specialists who knows what to look for.